My name is Dr. Eric Fleischman. I'm an American physician and surgeon working in Asia, and I have been treating men, women, and children for hormonal abnormalities for almost 30 years. That's a long time. One of the most common questions that I'm asked is, when should I check my hormones? Well, let's talk about women. Every woman at the age of 40 and over is going to experience a hormonal imbalance of one sort or another. Now, there's 55 hormones in the body, but for women, what we're looking at is estrogen, progesterone, and, believe it or not, testosterone, the male hormone, which is super important for a woman's sense of vitality, sex drive, energy, muscles, everything. So at the age of 40, a woman should have a hormonal check. What we see most commonly is imbalances of estrogen and progesterone. When that happens, a woman is going to feel tired, have some memory loss, lower sex drive, increase in some of the fat in the areas that they don't want it, and losing fat in the areas where they do want it. All of these things indicate that there may be a hormonal imbalance. Most doctors will tell a woman, just wait, go through menopause, and then you'll feel better. Women do not have to do this. There are so many treatments that a woman can do before she goes into menopause to increase her own natural production of hormones and get back that vitality that women feel when they're in their 20s and 30s. There's no reason to wait. Very simple. Talk to the doctor for 15 minutes. Very simple blood tests, and the answers are available the next day on what a woman can start to do to feel better, stay younger, and not to lose that really important hormonal imbalance in her body. Well, for men and women, it's a little bit different. With women, women know when their hormones are abnormal. They feel different. They lose their menstrual period. It's very, very obvious. For men, not so obvious. Because as a woman's hormones drop off the cliff like this, a man's hormones, his testosterone, will slowly get lower and lower and lower and lower over time. So what should a man think about during this time? Is my memory getting worse? Am I starting to get more fat around here? Has my sex drive gone down? Maybe the man can't get erections like he used to or perform sexually like he used to. All these things are very easy to figure out why. A simple blood test. Is the testosterone normal? Another blood test that most doctors don't think about with men. Men develop high estrogen as the testosterone goes down. Estrogen is a woman's hormone. As that hormone gets higher in a man's body, sex drive goes down, sexual performance goes down, fat comes up. This is very easy to find out. So my suggestion is for every man over the age of 40, come in, simple discussion with the doctor, 2-minute blood test. All the answers are there on not only what a man can do to maintain his strength and his sexuality, but also to prevent it from going down when he's young. Testosterone treatments for men don't just mean giving you testosterone. We have treatments that can make men produce more of their own testosterone for a longer period of time. That's for younger men. When older men come in, if their testosterone is low, we can replace it, and many other things to make any man from the age of 40 to 70 feel like he's 30 again. The question I'm asked now is, why do women, and not just in Asia, but all over the world, have a hormone decline at a certain age? Very simple. The number one answer, number one over everything, stress. Very simple. Your body has 2 hormone pathways, although there's 55 hormones, stress and sex. Your body cannot make stress hormones and sex hormones at the same time. We live in a world with a lot of choices: work, job, family, food, exercise, stress. When all these stresses happen to a woman, she stops making normal healthy hormones like thyroid hormone, estrogen, progesterone, all the things that make a woman stronger, and she starts making stress hormones that tell the body to survive. Simply lowering stress can increase a woman's hormones, her natural, healthy hormones. Simply getting a good night's sleep, simply taking certain supplements that will help the body to make more healthy hormones. All of these things can stop that really fast decline for women into menopause. Very easy to do. There's actually tests for stress hormones. Woman comes in, talks to the doctor for 5 minutes, gets the lab test, and all the answers are there within 24 hours. So what happens if my hormones drop is a good question I get. How is that going to affect my life? It's going to affect it in two very, very important ways. One, the quality of your life, your ability to enjoy life, your ability to interact with people, your ability to be there for your children, your ability to work, your ability to function, your ability to take part in your own life. Number two, the length of your life. Drop in hormones will lead to very potentially serious diseases, heart disease, strokes, diabetes. All of these things are hormone related. Healthy hormones, healthy body. Hormone imbalance, imbalance goes throughout the entire body, not just the sex drive, not just the weight, but all the organ systems. We now have the ability and the science to manage aging. So you do not have to get old if you do not want to. I'm going to say that again because it's true. You do not have to get old if you do not want to. We have the biologic, natural ways of maintaining good health and good hormones that can keep you strong and functional all the way up to 90 or 100 years old. Very simple to figure out. One blood test, discussion with the doctor, find out what works individually for you, and you're on your way to staying young forever if you want to. Most men with hormone problems start at about age somewhere in the middle 40s, 45 and above, definitely by age of 50 if it's going to happen. But there are a certain amount of patients that I've seen over the last 25 years. I have cases of men coming in even in their 30s with low testosterone. What's the cause for it? Usually stress, usually bad living, too much alcohol, not enough sleep, all the things that wear the body down. If you're a young man and you're starting to lose your sex drive, gain weight, lose that clarity in your brain and your memory, very simple. Come in, get a blood test, check your testosterone, check some of the other hormones that support your testosterone. And we have ways now for young men where we don't have to give them testosterone, but we can make a young man produce more of his own testosterone and bring him right back to normal. Any question about this? Come in, get a blood test, talk to the doctor. Very simple. Within 24 hours, you'll have your answer. So at MidEase, what kind of program are we following? Is it from Asia? Is it from Europe? The truth is that at MidEase, what we've brought is all the latest technology from the USA, where I trained, and I've been a doctor for over 30 years. All that technology is now available in Vietnam at MidEase, as far as the hormones, intravenous treatments, peptide treatments, vitamins and vitamin infusions. These are all following the American anti-aging protocols available here in Vietnam now. I've been doing anti-aging medicine for almost 30 years in America, in Asia, all over the world. Not only am I a professor of anti-aging and certified in anti-aging, but I am a student and a participant in anti-aging. I am a 62-year-old man. I've been doing anti-aging for over 20 years. I haven't missed a beat. I feel as strong as I did when I'm 30, except smarter, and I have a little more energy than I did before. So people ask me, what is the secret? Like there's a secret to anti-aging. There is no secret to anti-aging. It is pure biology, and it's very, very simple if you break it down into 3 areas, all 3 which we do at MidEase. Number 1, are your hormones balanced? Number 2, is your IGF-1 or your growth hormone levels, have they been optimized in your body? Number 3, and this is the most important one, this little guy right here, the mitochondria. This is the battery, the power source of every single cell in your body. If this guy is strong, you're strong. If this guy has energy, you have energy. Okay? So, how does that work and how do we change things like that? Any number of ways. Balance the hormones. Now, on the other side, when it comes to mitochondrial strength, this guy, cells in your body require energy. And the only reason that we get old is because this mitochondria, this battery of the cell, starts to lose power. It's as if you have your iPhone and you put a Nokia battery in it, it's going to run down, it's going to fail, it's going to die. Now, certain organs in your body have more of these mitochondria. Your brain and nerve cells, your heart, your muscles, your organs that produce sexual hormones. These are organs that function 24 hours a day. They never ever stop. So they need a constant source of energy. So how do we feed these mitochondria? The best way is with something called NAD, nicotinamide adenine dinucleotide. Now, this is a substance that's been around for over 100 years. The scientist who found it over 100 years won the Nobel Prize. We have NAD now in an intravenous form. It goes into your vein, and it makes every one of these batteries feel like they have just recharged and you're 20 years old, okay? Not only do I treat hundreds of people with this, but I do it myself every 2 weeks because this is going to be the source of constant energy in your body. Not only does it give your cells energy, not only does it make the cells work at full function, when these cells decide to divide into a new cell, they divide perfectly. So there is no aging process between that time. Now think of it, if you do this over a period of 2 years, 3 years, 5 years, you have cut off 5 years of aging, and you will be aging 250% slower than everybody else you know. This has already been proven biologically and genetically. On the other part of it, growth hormone, HGH, IGF-1. This is the hormone that comes from your brain that makes every cell in your body believe that it's young and that it can function at its highest level, be it your heart cell, your liver, your brain, your muscles. At MedEase, we check all these levels when somebody comes in, and then we can come up with an individualized plan on which of these modalities, hormones, IGF-1 therapy, NAD, mitochondrial therapy, which one of these are going to put you at your optimum youth and your optimum health. If you can get a balance of these three things, I can guarantee you that you will stop getting old. You will look in the mirror, you will see a different person, brighter skin, better hair, more energy, more focus, and most importantly, more brain power and more ability to engage in your life the way you want to be. Not engage as an old person, but engage as a person who's lived a long time and is still tenaciously involved in everything going on in life, be it work, love, children, whatever you like to do. So these are all the most modern, most biologic methods for staying young. It is not a secret. It is pure science and pure biology. Question is, what is NAD therapy? What is this new therapy? Well, the truth is that NAD has been around for well over 100 years. In my early career, I was an oncologist, a cancer specialist, and an infectious disease specialist, and specialized in treating patients with HIV and immune disorders. We were using NAD back then to increase the immune response in people, because NAD does that. NAD gives you a strong immune system. But what does it really do to work? Well, the secret is in this guy, the mitochondria. This is your cell's battery. This is your source of power for your entire body. This little structure, which is in every single cell in your body, is responsible for every thought you have, every move your muscle makes, every action you want to take. This is providing the energy. NAD is the pure source of energy for this battery. Now, when you're young, when you're 20 years old, 25 years old, These batteries are supercharged. They can do everything. You can stay out all night, work 20 hours a day, and go right back into it. When you get to be older, these batteries start to wither. They start to fail. When they fail, you fail. NAD puts the energy back into these mitochondria and makes them function as if the cell was 20 years old. 20 years old, no matter what age you are, this revitalizes the cell. It's almost a biohack to make your body believe that you are 20 or 30. NAD comes in many forms. It comes in a pill form, but this pill form does not get absorbed very well. The IV form, intravenous form of this medicine, very powerful, very effective, very reproducible. I think in the hundreds and hundreds of patients I've given it to, we've had a positive effect over 95% of the time, and people always come back and ask for more NAD. Is it a trick? No. What it's doing is it is actually making your body believe that it is 30 years old. This has to do 30-year-old immune system, 30-year-old brain, 30-year-old muscles, 30-year-old sex drive. This is for real. So NAD therapy, even though people say it's new, as I said, it's been around for over 100 years, but the intravenous form of it, the form that we use here at Mediz, is the latest developed European form. Very effective. I'm going to keep doing it for the rest of my life, and I don't plan on ever getting old. So if you have questions about NAD, come in, ask about if NAD is right for you. The people we've used it on, it can treat diabetes, weight loss, brain fog, loss of muscle, increased hormone production, natural hormone production. So NAD is pretty much the right type of therapy for so many different people who are in their 40s, 50s, 60s, all the way up to their 80s, who have lost energy, who want to get back that feeling of their being, of participating in life to their fullest physical extent.